Dr. Gabone, QHSC.
Hi Tricia,
Hi.
tell us about coronavirus.
Corona is bad virus. Wash your hands with soap. Don't touch your mouth. Don't touch your nose. Don't touch your eye. Don't touch your ears.
Thank you.
Vá baracoa.
Welcome to the third QHSC Health Conversation Series, Community Outreach Pediatric Perspective. So what it means that as QHSC working together with your organization, Magnet Youth Soccer Association, we are trying to educate your peers, your friends, and family member about how we prevent ourselves from COVID. And so today's meeting, I have Mrs. Irene Gabone here. She's a nurse from Norwich, New York, and you're gonna hear her from a few minutes. So she is gonna ask those questions to you guys. And so when she point on you and you answer, just answer as honest as you can. And if you don't know the answer, that's okay to say, I don't know, and let somebody else answer it. And it's okay. So we can all learn from each other and make sure that we learn to protect ourselves. Because remember, we don't want to get sick. Remember, this is my third time with you guys. We already discussed about eating health, how to prevent diseases. So now we have things that are happening in our life that causes disease. So we need to be as healthy as we can so we can play our sports. Because if you are sick, you can't play sports. And I know guys, you like to do sports, right? Maybe, yes. Like Malcolm. But yeah, so being healthy helps you guys to be able to go and do the sports, and eating well also keep your body healthy so you can do your sports. And if you're healthy, then you can help your parents at home so they don't have to do all the work by themselves. Oh, hi. We have Mom there. Okay, welcome, thank you. So I'm just gonna give you like a few seconds, each one of you just introduce yourself so we know who we have here, and then so at least we can refer to your names when we're talking to you. So I'm gonna start to my right here is Malcolm. So just tell me your name and how old you are, and why are you here?
Okay,
Go ahead,
my
Malcolm.
name is Malcolm. I'm 10 years old.
Okay. Thank you, Malcolm. Okay.
My name's Christian Fernandez, and I'm 12 years old.
Oh, okay. Nice meeting you, Christian.
Hi, my name is Nase. I am 9 years old.
Are you 8 or you 9?
9.
And who do you have behind you, Nasi?
Sajigwa. I'm Malupindi too.
Okay. How are you, Zajigwa? How are you?
I'm fine.
Okay. And how old are you?
I'm 10.
10? Wow. You're too big.
I remember I went to US and I saw you.
I know. That was a long time ago. Nice to see you again. Okay. Danny?
My name's Daniel, and I'm 10 years old.
Okay. Nice meeting you, Danny.
My name is Marlon Monsasu. I'm 11 years old.
And 11 years old. Okay, nice meeting you, Marlon. Thank you for coming. Okay, so I'm going to let Miss Irene here introduce herself, and then we can start.
Hi, everybody. Hi, guys. That's very nice of you to join this meeting. My name is Irene Gabone, and I don't want to say my age, but I'm a nurse in Norwich, New York. I'm an adult. That's good enough?
Yes. Thank you, Ms. Irene, for joining us. As I said before, Ms. Irene has been a nurse for a long time, and she works in medical surgical unit, means that you're taking care of adults who are sick at the hospital, different diagnoses, and then including COVID patients. And so she has enough knowledge of to come and share with us about the patients who are sick from COVID, things that we as nurses to do with COVID. But today our focus is you as children and your family members in the community. So she is gonna be guiding all the questions. So she'll be like almost a moderator, try and guide you through the questions, different questions. And our questions are gonna be based in 4 areas. So we wanna find out what you know about COVID, and then we wanna find out how do we wear a mask, how effectively, and if it's beneficial for us. And then what do we need to do? Prevention. What do we need to do so we can protect ourselves, our family members, and our community about the disease? And then things that we need to take away from now to go and help our community. And especially if you guys are going to school, we want to make sure that you have the knowledge to go and teach others, okay? So thank you very much, Ms. Irene, for being here. And if there's any parents with us yet, I really appreciate if we get to know you a little bit, because the more that we learn from each other, the more we can impact our kids. So then our kids will know how to take care of themselves. It's gonna be shared globally, means like the whole world. So where we can send it, it's gonna be posted in YouTube and then posted in the website and then send it through the WhatsApp. So everywhere in the world, the children will be able to see it. So I'm hoping that they can learn from your responses. And if you have any question, that's okay. You can ask us, and Ms. Irene will be happy to answer those questions. And then if there's a question for me, then I'll be happy to answer that. So before we start, any questions, any concern about how it's gonna be today? No? Okay. Okay, so Ms. Irene, go ahead. What questions do you have?
Okay, everybody's ready?
Yeah.
My first question is, how do you understand communicable diseases? Malcolm?
This is Malcolm, and by understanding what are communicable diseases are diseases which can spread from one to another.
Thank you very much.
That's very good. Oh, another question is, do you know how to protect yourself from communicable diseases? Danny, you wanna answer this?
Yes. Ways of protecting yourself from communicable diseases is to wear masks, to stay far away from people who are maybe sick, and not to share food with other people.
Very good.
Okay, good. Very good.
Anybody else wants to add?
And Marion.
You can protect yourself from these diseases by maybe wearing something to cover your face with something like a mask. And maybe you can wash your hands after touching surfaces that you think that are infected.
Very good, man.
Another way of protecting ourselves is to stop sharing things with other people, because you never know if anybody is infected.
Very good. And Christian, you wanted to add something?
Stay socially distanced and sanitize and wash your hands more often.
Very good.
To how to prevent that, you should not stay close to people who have the disease, which is communicable, which you also get it. So you should say social distance.
Very good. What? Oh, this is an additional question. What is a social distance? Go ahead, Narcy.
Social distance means that you should stay far away from each other.
Like how far is too far?
Like 2 meters.
Say 2 meters?
Yeah.
Okay.
Oh. All right.
I think Jakaya is raising the hand.
Social distance means keeping a safe space between yourself and other people who are not from your household.
Okay.
Very good. Very good. Okay.
Social distance is when there's a distance between you and another person to prevent spreading germs.
Very good.
Okay. All right. I think we all got that right, and we learned from everybody. So we can move on to the next question. Does anybody know anybody who has was infected or was sick from coronavirus?
Yeah, you don't have to say the name, but if you know if somebody has been sick, you don't have to say a name.
I know.
You do? Okay, that's fine. Thank you. Anybody else?
My name is Caleb.
Hi, Caleb. So do you know somebody who has infected with COVID or?
Yes.
Okay.
Okay, you guys did a great job. So we can move on to wearing mask questions. What are you benefiting from wearing a mask? Danny, you wanna go first?
You can prevent yourself from diseases. Example, if someone accidentally sneezes on you, your nose and mouth are safe.
Okay. So you're not breathing what they breathe out from them.
Yes.
Okay. Christian?
By protecting other people from your germs when you sneeze or cough.
Okay, that means if you have germs, if you are sick, so when you sneeze, it doesn't get to other people.
Yes.
But
barakoa. Kama barakoa yako. Hapana, siwezi kukupa. Wewe ni mdogo chini ya miaka 6. Usivae barakoa ya mwenzako.
So the cloth mask, if we wear like a cloth mask, is that going to protect you, me, and the other people in the community, other people around us?
Yes.
I'm speaking about a cloth mask. Good. All right.
Thank you.
Anybody else has a different opinion?
Well, I'm actually going with Jakaya's opinion.
Oh, okay.
Good.
Thank you.
Okay.
Barakoa.
Does everybody knows how to wear a mask? If you have a mask there, you can demonstrate how to.
I don't know how to wear a mask. Can somebody show me how to put on the correct way of putting a mask on? I see Danny's raising her hands. Yeah. Go ahead,
Okay.
Danny, show me.
Yes, so I have a mask over here.
Okay.
So first you take the 2 side corners and stretch them out so the middle part covers your mouth and nose. And put the strings behind your ears.
Okay. Oh, what about the nose part? Do you do anything with that?
Yes.
Show us your mask again.
Okay, so I have a mask here, right? But then the correct way is to first check at the center so that they can make different angles for this side and this side, and then take these strings, keep them on the left and the right ear, and then if you want to protect yourself properly, you keep this top part on top of the nose.
Okay, good. So I have my mask here. It looks similar to you as Malcolm. And I can show you showed it correctly. And I do it all at the same time, but I think your way is even better. You start in one side, then you don't go to the other side. And most mask is this kind of surgical mask. Here they have like a little wire, and if you press it a little bit to foam, like so it's right on your nose. You know how your nose has like a little bridge up. So try to press it around it so it covers better, so you don't breathe anything in through that little holes on there, that little space. Yeah, I don't know. It works better that way. And if you take it out, you'll see that it's a little bent right there. I don't know if you can see it like that. Yeah, so that forms like the bit of your nose. All right. But not all masks are like that. We also have like the cloth mask, which don't have that little wire there, but those tend to sit properly around your nose. Anybody has anything to add there?
So thank you, Malcolm, and thank you, Ms. Irene, for demonstration. Anybody has a cloth mask with you? You want to show us? Yes, now.
I have a mask here, the cloth one.
That's a beautiful one.
So how mask wear it? You start in the top and go here, the left. And then you push this up.
Good.
That is very nice. It's a beautiful colors. I have mine too, but mine, yes, it's a cloth mask, but still comes with a little wire Miss Irene was talking about, which majority of the people who are wearing at home, the vitenges and stuff, don't have that wire. And you don't have to go and put it in there, but usually it fits very well after you put it snugly on your ears. So luckily mine has the wire, so I just start usually from my nose bridge, so I know for sure it's there, and then I pull back on my ears. And then I make sure it covers up here, the air does not come. If you have glasses here, you can put like that on top of the glasses, so the fume, the moisture does not go through my eyes, my glasses, so I don't see it. But it covers. You can see if I'm talking, the cloth move in and out. It allows me to breathe. So yes, it might be after a while, you can wear for a long time, but it still might, after a while, you have to take it out and just breathe a little bit. But yeah, but it has to be snugly so you don't breathe. Like I think Jakaya was saying before, where the mask is going to protect you if you sneeze. Then yeah, even if I sneeze, it's going to be contained inside my mask. And then so you can take it out if you need to, and make sure you don't touch inside and outside and contaminate if there's anything around it. Okay.
Good job, guys. Okay. So move on to the next question.
Yes.
Yeah, can you borrow your friend's mask or somebody else's mask and wear it? What do you think, Malcolm?
You can't borrow someone else's mask, because what if before when he wore it, like he sneezed in them, so that the germs, since you didn't touch it inside like in this part, see that like the germs are gonna still be there. So if you wear it, the germs can easily come in through the mouth or the nose. So it's easily, and you can get contaminated through a certain disease or an infection.
Very good. Do we all agree with Malcolm?
Yes.
Anybody else has different opinion?
Yes.
What if you go to school, you get to school, you just realize you didn't bring your mask, and your friend Malcolm has 2 masks? What are you doing?
It's nylon. If you take your friend's mask, what if your friend touch the mask and he might be contagious, and then it gets onto your fingers, corona, because of that incident?
Okay. All right. Good job. So we all agree no sharing masks, right?
Yes.
Usivae barakoa ya wenzako.
Thank you.
Yes.
All right. Or we can move on to next section.
Osha mikono kwa sabuni na maji tiririka.
Do we all know how to wash our hands? Can anybody demonstrate how to wash hands? Who hasn't answered any question yet? Do we have Christian?
Yes.
Whoa.
So first you open the tap, then rinse your hands, and then you put like 2 or 3 dabs of soap on your hands, and then you start rubbing the soap all around your hand, between your fingers, and until your wrists. And then while you're washing, you wash for about like approximately 30 seconds, I guess. And yeah.
And then what? After you wash that long, then what?
And then you can dry your hands.
What happens if I don't have anything to dry with? I can wipe on my clothes. Right, Christian?
A towel, maybe. You could wipe your hands on a towel.
What happens if I don't have a towel?
Then let's say you have clothes, okay? So you can use like your pair of shirt or whatever, and then you can wipe your hands.
Why can't they just shake it and then probably all the excess water is going to go away? In the rest of it, after a few minutes, and my hands are going to be dried up anyway, right? So if you have access to the towel, that would be great. But if you have access to the paper towel, that's fine. Or if you don't have access of any of them, just water, maji tiririka, right? And then you shake the excess of water, and then you go on.
Yeah, dry.
Yeah.
Okay.
Anybody else wants to demonstrate?
Go ahead, Jakai.
Madam, I think when you shake your hands after, if you shake your hands, I think you're gonna cause you're gonna spread the virus again. If the virus is still in your hands, you can spread them.
Nobody, remember he said, wash your hand with soap and then scrub. Although he said 30 seconds, it could be 20 to 30 seconds, that's fine. And then you rinse it. By then, with an assumption that the bacteria, virus, whatever the germs, dirt is in your hand, it's been washed. If you wash it, and then so you're not
wash proper.
If you wash properly, it should be gone from your hands. So when I'm saying like this, you're not going to spray it to people. You just shake it just so it doesn't drip all over the place while you're walking around. And most of the time, as I said, luckily in the restroom, it's warmer, so it's going to dry quickly. If you don't have the towel, let's say you go to the bathroom and sometimes vile vyoo vya kijijini, you don't have towels, you don't have paper towels, you don't have anything to dry your hands. What happens if you're doing exercise? If you wipe your hands on your cloth, it's going to getting the dirt from your cloth to your hands now. So the safer way is just to shake it. I mean, when I'm saying shaking, just like a little dripping, so all the extras. So it's
not that.
Not like this, everybody else. No. Just dripping, so like you don't drip all over the place where you're going to. But using your own clothes might not be clean because it might be coming from exercise, and especially, for example, if you guys are doing your practice, playing soccer. So you go to the restroom and use the restroom. There's no paper towels there. There's no towels. And in fact, in the recommendation that if there's a cloth towel hanging in there, majority of the people using it, that becomes unsanitary because everybody else keep wiping their hands in there. So usually if it's disposable towels, that would be great. But also the safer way, you can just shake it gently to try and remove the excess water so you're not dripping all over the place versus putting on your clothes. But with an assumption that if I wash my hand with the soap, I already kill everything. So hopefully my hands are clean. But if you did not wash it very well, then yes, the virus is going to be on your hands, the bacteria is going to be on your hands, the germs is going to be on your hand, and yes, if you are shaking to everybody else, you are going to spread it. I agree with you. Does that make any sense, Jakaya?
Yes.
Thank you for the question. Go ahead, Mrs.
All right. What should you take into consideration when you are washing your hands? Like, what things you want to make sure you are doing? Correct. Probably most of this has been answered, but I just want to make sure we mentioned like we scrub, particularly, can you go into details, anybody, like how do we scrub? And
yeah, can somebody just demonstrate on the screen exactly how? I think Kristen said just put those 3 or 4 dabs of soap, which is fine. I want somebody to show me how you scrub your hands, how you put that lather in your hands. So if I don't know, then I can learn. I think is it Kristen and somebody? Kristen, do you want to do it again to explain it, or somebody else who wants to do it?
It's fine if somebody else does it.
Okay. No, I see another Kristen. Is it Nancy? So
I can show something and you can tell me if I did it right or wrong.
Oh,
this
yeah.
Is what let me show you how I wash my hands. After I get my hands wet, I'll put some soap, then I'll do like that for 30 seconds, then I'll rinse. Did I do it right?
And Jakaya, you want to show her the right way?
Yeah.
Please do, yes.
Yeah. First, you rub your hands like this. Then you scrub them between your fingers. Then do it like this. Then like this. Then you can just wash them normally.
Okay.
Anybody else has a different technique? Thank you, Jakaya. Anybody has anything to add there? Somebody was on
Okay.
iPhone.
Caleb, is Caleb available, or do you have a video?
Yes, it's available. I'm speaking.
Yes, go ahead.
You can you rinse your hands first. You do dabs of three dabs of soap. Okay? Then you start washing the normal way. Then you do like this.
But we can't see. You have to describe it. Describe how you do it.
How do you even do that? Because that's how I normally am.
No, we want to see your hand. When you said you do like this, what is this? We can't see you.
I can't see. I mean, like, I can't do it.
That's okay. Okay, now go ahead. Go ahead, and then I'm going to demonstrate what you are saying, so then if you tell me if I'm doing it right. So go ahead.
You scrub your hands for at least 20 seconds.
Okay.
Scrub your hands with soap at least with 20 seconds. Then you rinse it. Then you're done.
Okay. So are you talking about, this is how I do. Wet my hands, get the soap and put it on my hands and create the leather. So then I know Jaka was trying to do this. That's fine. You're washing the tip of your fingers. That's fine. You can do the same thing between your fingers. So you interlaces your fingers. You're cleaning between like that. So go back and forth. You're scrubbing. That's fine. So by the time you finish all these things and your thumbs, go the other thumb and you finish it. When you go to wash it, you're just not gonna wash like that. Usually you wash it and rinse it. So from here to drain all this dirt. So like if you have the water running, then that's fine. Or some people do like this anyway, trying to clean it up and let the water runs. If you have a towel, disposable towel, great. You don't have a towel, lose the extra stuff. Is that what you're talking about, Caleb?
Yes, I was talking about that.
Okay, thank you.
Good. You're welcome.
Thank you, Caleb, and thank you, Dr. Harriet.
Naenda kuwaonyesha jinsi ya kunawa mikono kwa sabuni na maji tiririka. Nachukua sabuni. Unaona?
We can move on to next question. Do we think, is it necessary to have some gathering of like a big group of people gathering for like a wedding, traveling or funerals? What do you think? We can, Marlon, you have your hand. Oh, everybody has their hands up.
It is definitely not necessary because you might risk getting corona from people because of how close you are, and the large groups can cause many people to get corona.
Very good, Marlon. Anybody else wants to add there?
Could, because it's a bit risky, and also it's possible because you can also stay socially distanced and also sanitize often when you're at a wedding or a funeral or some occasion where you're with a group of people.
What do you think, Malcolm?
It's not necessary for people to gather around because almost every virus travels very fast and it is very easy to get it. So it will be very risky and very dangerous for people's health. So I advise other people to not do gathering that often.
That's very good. And you know, there are some gathering that you cannot avoid going to. If you really have to go, you try to make sure you wear your mask and keep the distance, wash your hands, and take all the precautions if it's really necessary to go.
That's true.
But I do agree with you. It's probably not the best idea during the pandemic.
Panguza mikusanyiko.
And what kind of food will help you from not getting the disease? Let's see how many hands we have up here. Dr. Harriet, you can pick.
The question is asking like, what type of food should you eat to prevent you from getting sick easily? So remember when we did the food diary what type of food that we need to eat, and then so we can stay strong and build our immunity and stuff. So this is the question referring that part. So what are the type of food that you need to eat that will keep you healthier longer and protect you from getting sick easily? And I see all the hands right there. Okay, Nancy, you want to start?
I think fruits will help you because it gives you more vitamins and you need some vitamins.
Great.
Very good.
Mm-hmm. Christian, go ahead.
Fruits and vegetables and foods that don't have so much oil and fat.
Okay. Yeah.
Eating a balanced diet so that you can eat, so that all the energies from all the types of foods you get can go through your body, and so that you, and then mostly fruits and vegetables because they're a very large part of vitamins, and vitamins build fight against diseases and bring up your immunity.
Very good. Wow.
Very good.
Very good, Malcolm. Okay.
Okay. Anybody else wants to add anything?
We need to eat vitamins because they build our immunity so that we can fight against the diseases like corona.
Very good.
Or at least just keep it away for some time.
Very good.
Hopefully keep it forever. That was good. Keep it away from us. Very good, Maron.
What about good sleep? Like good sleep, is it going to help you from getting too sick with the coronavirus? Lusajo, go for it.
Good sleep helps your body to heal after like the damages, and it depends by the food which you eat.
Thank you, Sergio. Jakaya?
Yes, we should eat fresh and unprocessed food every day.
Very
good. So we all agree good sleep is important to fight the disease, right? Malcolm, what do you think?
About good sleep, it's advised by many doctors and other health agencies that it's better for humans to sleep for 9 hours maximum or above, so that it refreshes our immunity, and so that the immunity stays strong and always be active.
Very good. Very good, Malcolm. What if you have that game you have to catch up, and people you are kind of behind, you are behind on that video game that you play every day, and you have to spend 4 hours playing it? What do you think you should do? Go for the game or get a good sleep?
It's better to get a good sleep because it refreshes our mind, and so that it makes our body to be strong and refreshive and active all the time.
Very good. Is everybody agreeing with Malcolm?
They're doing the thumbs up. Yes, people just put a thumbs up. Dan is one of them.
Symptoms. How do you, when you have it, what are the symptoms? Anybody? There are many if you wanna go for some.
I see Christian, JJ, Jakaya, all of those are raising their hands.
Okay, we can start with Marlon. Marlon, go first.
We'll have like dry coughs, fever, high temperatures. There's colds. The kidney problems.
Christian, you wanna say something?
Some of the symptoms are fever, dry cough, tiredness, maybe aches and pains, headaches, and maybe diarrhea or sore throat. And yeah.
Okay, thank
Very
you.
good.
Yeah. How about Nasser? Nasser?
Some of them are like hard to breathe.
Very good. How about Jakaya?
Muscles or body ache.
Okay.
Very good. Malcolm?
The three major symptoms of COVID-19 are having a hard time breathing, always having dry coughs or sore throats, and also getting a high temperature and a decent high fever.
Okay.
Very good.
JJ?
Okay. Okay, so there's chest pain or pressure or loss of speech or movements. That's all I know.
Very good.
Okay. Very good. So there are a number of symptoms for this coronavirus. So don't ignore any of the symptoms if you have any.
So to add for that, you guys did an excellent job providing those possible symptoms for somebody who may have contracted the virus. But just remember, majority of those symptoms are what the adults have been presenting to the healthcare providers or doctors or hospitals, complaining about the symptoms of, and find out later that they're COVID-19 positive. So we are still learning about the pediatric population, which you guys are. So anybody who is 3 days old up to 18, 19, all those are pediatric group. So if you're in that group, your symptoms may not mirror those, what you just mentioned, could be, but might not be necessary. So any symptoms that you might have, something that does not sound right, feels right, or does not hurt, I can say the muscle achiness. Remember, you do your exercise or your practice, and they might say, oh, maybe just because of my exercise or because I've been running around too much today. And then it continues in a day, 1, 2, 3, 4. You're getting more weaker. So that could be another symptoms. You might have diarrhea. Maybe the adult may not have the diarrhea, but the children might have diarrhea. And sometimes the children might have like what we call like an inflammatory response. It's something they might have like allergic reaction. So what we were trying to say here, for children, the symptoms might not be exactly the same as adults, but wherever you feel that is not right for you, it's not normal for you, just go and report to your parents as soon as you can. Or if you're at the practice, then tell your coach. So they know maybe something is not right. So then you make sure maybe the appetite. Some people will lose the appetite first and they start feeling weak, or they might start feeling weak first and then lose the appetite. So they're still learning. So any concern you have, don't just say, oh, but I don't think that was or not on the list they mentioned. No, because your body may react differently. So just be careful, okay?
Jakaya, go.
I wanted to add something about all the adults and people who have problems like heart problems, lung diseases, or diabetes. It seems to be at high risk for developing more serious complications from COVID-19 illness.
Very good.
Oh, thank you so much.
Very good. I was just saving to the last, but you beat to it. Very good, Jakaya. I'm impressed. Very nice.
Another question is, what do you need to do if you get sick from coronavirus? Or if you happen that you are having difficulty breathing, what should you do?
The first thing you should do is to keep yourself from any person who is not infected. Secondly, you have to go to the hospital if you're feeling unwell.
Okay.
The most important is to stay at this point, you know you are sick, try to stay away from people, even people in your family. If you can quarantine, just stay away so you don't spread the virus to other people. If school, you need to stay away. Don't go to school. Don't go to practice. Don't be around other people. That's very important. And if your symptoms are really, really bad, then you cannot breathe, then you definitely need to go to the hospital and get some help and medications and things like that. Dr. Harriet, I'll hand all this back to you.
Okay, thank you very much for asking those questions, and thank you everybody. You guys provided a lot of answers, and you guys know your stuff, so I'm glad. And so make sure you don't keep that information to yourself. You need to share with your family members, you need to share with your schoolmates, you need to share with the community. So if you see somebody else who is asking or have any questions about it, then yes, you need to be able to share that information. Some schools, I mean, as far as I know, some schools might put that recommendation that every student should wear a mask. So if your school requires you to wear a mask or recommends you to wear a mask, then definitely wear the mask and show those other schoolmates how to put on correctly, because some people will wear a mask and do this. So what exactly am I protecting here is because this is almost the same as don't put it on at all. So definitely you can tell them that, yeah, the reason you're wearing is because the any communicable disease that is transmitted by airborne means like the moist or when I sneeze or cough, all those things are being protected with, even with the cloth mask, be protected. So they need to know that they have to put their mask on to protect the nose and the mouth. Avoid touching your eyes. So because if I wear a mask and I keep putting my fingers in there, I'm gonna introduce the infection in my eyes. So you have to be able to educate them so they know what it is. And you guys know that as an athlete, you have to eat well-balanced diet. I was so excited to hear Malcolm saying that, eating balanced diet to build their immunity, because if you wanna be healthy, you gotta be able to strong to do your exercise. So to finishing up, so I want at least every single one of you just say your name and then give us at least one thing that we need to learn from this COVID, either as prevention or things that we need to look forward. Like if I say, give usia for somebody else who does not know about COVID, just one thing. So everybody should introduce themselves and then say that, and then that will be at least the last thing we are discussing today. As I said, thank you very much, everybody, for your time and giving us all this education. So we can start, whoever is ready. I see Maron is in front of me right now. Okay, go ahead, Maron. What should we learn about the COVID and all this communicable disease?
We learned how to wear a mask.
Thank you, Maron. Anybody else?
So we learned how to wash our hands.
Okay, thank you.
Learn how you can get COVID and how you cannot get COVID.
Thank you very much, Caleb. Christian?
We learned how to prevent COVID and how it travels.
Okay, thank you.
JJ?
What I've learned is that corona can be passed on from people to people really fast.
Yes, I agree. Thank you. Okay, so as we are finishing up, as I said, thank you very much, everybody, for coming today and spending time with us. So as we're finishing up, if everybody can just be on the screen, even for a few seconds. So I want to have a picture of everybody who attended today. And to say thank you for your time, thank you for your knowledge, and just be safe. And thank you very much, Ms. Irene, for your time to moderate this discussion and conversation about our health. And thank you, Nancy. Thank you, Jakara. Thank you, Danny. Thank you, Christian. Thank you, Maron. Sergio. I don't know who is JJ, but we're gonna call you JJ. That's fine. And yeah, so thank you, and Caleb. So thank you very much for your time. And I know you guys is late, so I'm gonna let you go to sleep. But everybody can wave. Nicole. Bye.
Thank you. Thank you very much. It was a very insightful session, especially with the kids. Yeah, thank you for taking this initiative, especially to Magnet. They really care about our kids. We're very grateful for that. And to you, Harriet and Irene.
Thank you
Asante sana.
Oh, asante sana, Nicole. Yes. No, we appreciate the kids know quite a bit, so we always learn. Sometimes we forget how much they know, so it's nice to see. Yeah, and thank you for the parents that allow us to come and share with the kids. So, as I said, we're going to share this video worldwide, so everybody's going to see how intelligent you are and how we can learn from you. So, thank you for your time. Okay?
Bye.
Bye.
Bye bye.
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 Hi, Maron, are you okay? You're wearing a mask already.
Right. Just posting for the picture.
Oh, that's good.
That's very good. Yes, I will send all those pictures. I'll send the link probably by tomorrow. So I'll send the link so you guys can see, and then just share with everybody. Share your friends so they can learn from you. Because this is very good. Because if you protect yourself, protect your family, and protecting the community, that is a very good thing to do. Yes. So thank you. Okay. Bye, guys.
Bye. 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 Bye, Nancy. Bye, Christian. Bye,
Bye, iPhone. We don't know your name, though. You're hiding behind the iPhone. But that's okay. Okay, guys. Okay, good night. Usiku mwema, yeah.
Bye.
Bye.
Okay, bye.
Dr. Gabone, QHSC.